Moving on, we have our second keynote by our eminent guest of honor on COVID-19 opportunities for disruptive innovations to transform healthcare, presented by Professor Mahmood Adil, advisor to Her Excellency Minister of Public Health, Qatar. Over to you, dear Professor Adil, and the stage is all yours.
So just to check, can you see my screen and my first slide, please?
Yes, we can.
Very good morning and Assalamu alaikum and Ramadan Kareem. And this is a wonderful opportunity to talk very briefly of my experience and my overall approach internationally, that what we have learned from COVID-19. And I think I congratulate the organizer of this conference, and I thoroughly enjoyed the discussion happened just now, because on one side, COVID-19 has touched the lives of almost every human being on this planet, directly and indirectly. And if you look at this is the very recent data from John Hopkins dashboard. So almost 500 million people affected by COVID, and then sadly, almost 6 million passed away. Where we are very concerned about what happened to the humanity, but the COVID-19 also helped us learn a lot, which will help us in the future to save more lives. And I think that is the main theme of my talk, that what sort of disruptive innovation has come out of COVID-19. So moving on, if I look at the pandemic trajectory, so this is the model I've used in the past. I was medical director for Public Health Scotland, responsible
Professor Adil, I'm so sorry to cut you short. Could you please click on the presentation mode?
Let me stop sharing and then start again. I think that might be better because it is not working at this end. Mm-hmm. So as I was saying, that the COVID-19 has touched the lives of almost every human being on the planet. Sadly, 500 million people affected, and very, very sadly, almost 6 million people passed away. But I think the COVID-19 has helped us to learn a lot, which would lead to save more lives in the future. And that is the theme of my talk, that what sort of disruptive innovations which could come out of COVID-19 and that can transform healthcare. So the next slide is that this is the pandemic trajectory. I was medical director for Scotland and responsible for all the public health services professionally. And this is what we did. And this framework showed that actually when we tried to deal with pandemic, it was on the 4 domains: prevention, identification, and managing pandemic, and managing the impact of health services. And that there were 3 cross-sectional themes: the public communication, professional capacity and capability, research and innovation. Just keep this in mind and you will see that this framework, which was developed out of COVID-19, is pertinent to deal with most of the challenges, in particular on the chronic diseases as well. And all the challenges we are facing here in Qatar, as well as anywhere in the world, could be addressed by a systematic approach, which we developed during COVID-19. I think Qatar has been very efficient and effective in dealing with the pandemic. But on the similar note, it has given us an excellent opportunity to see that where we can innovate more. So this is the next slide. And this is basically to show what disruptions happened because of COVID-19. The first main disruption was access to health services. So once the COVID-19 started, the access to health services got limited. And then the so-called the routine care delivery. So it means that apart from COVID-19, everything else which was happening in the health system almost stood still for a while. There were 2 main reasons. First, most of the capacity and capability of the hospitals and healthcare systems were taken by COVID-19. And second, the staff, because the staff themselves became ill, and that means there was not enough flexibility in the system or resilience in the system to deal with or in order to deliver all the routine care services. Third main disruption happened in education and training. So both in the clinical field and the non-clinical field, there was a big disruption that all the training and education almost stopped, or it wasn't able to move forward because the virtual systems were not mature enough in order to, and the students and the teachers were not very capable of dealing with those new innovations very quickly. And last but not least, one of the biggest challenge was escalating cost. So just keep those four things in mind, and let's see that what are the disruptive innovations which have come out of COVID-19. The first thing is, as you know, and wherever you are, whichever country you belong, you would realize what has happened out of COVID-19, that the health system became a data-driven system. It was there before, but suddenly everyone started realizing we need to know where the patient is, how many patients are effective, how many being vaccinated, it's all underpinned by data. So that was the first disruptive innovation happened. The health system started realizing that we have got a data-driven healthcare. Then the second one, because of that, we were able to do a better modeling and planning of health services. And the second one about the telehealth and telemedicine. So in order to deliver the care and try to be more innovative when the patient cannot come to the hospital, we realized that there were pockets of excellence of telecare and telehealth. And I can speak because I'm relatively new to over here in Qatar, but back home in the UK, we realized, and I did my best to convince the clinicians they should be running telehealth, telecare medicine, but in particular for the outpatient departments. Unfortunately, they were very reluctant. But immediately after COVID, they start realizing they need to provide the care, and the fear of unknown gone away. Then talking about the data, I always say that almost every health system collects a lot of data. But unfortunately, we are data rich and intelligence poor. So this is the way to see that how did we achieve or how did we defeat COVID-19 with data? So we started with so-called descriptive analytics, just to know that how many patients. Then we went into diagnostic analytics, that who is actually getting the COVID-19. Then we went into predictive analytics, which means that who is going to get the COVID-19. And I think the ultimate goal in any data-rich health system is prescriptive analytics. That is, what's the best outcome and how can we make it happen? So this is a trajectory or a pathway which we have learned during COVID-19 to create value from data. Then moving on, I mentioned about data, but I believe in intelligence. So data does not create value until you change into applied intelligence. And the applied intelligence is you need to be very clear why you are collecting the data, how best you are going to analyze it, and what answers you can get out of it, and how you can provide that data to the relevant people, to relevant clinicians, so that they can take actions. So it means we should provide applied intelligence to the clinicians, to the frontline staff, rather than the data. So there's a model I developed, but was implemented all across UK and a number of other places. And at the end, it is not the time to go in detail, but we need to have an applied health intelligence, which means we need to be defining it clearly. We need to do the data linkage. We need to have the right context. We need to publish and share it with the relevant people. But very important, and the most important, is we need to take action on the applied intelligence in order to achieve the right outcomes. But it is underpinned by availability of right people, right platform, and right governance. There was a very enriching talk before about the security of the data, accessibility of the data, and how best we can use the EPRs. So I think that is one of the key things we have learned, that we need to change data into intelligence. This is a reflection of the Scottish data, because I want to give some international examples. And this is one example that we were collecting data from birth to death, even before birth, because when there is the pregnancy, we're collecting almost 100% data on 5.3 million people. But the challenge was how best we can use that data to change to applied intelligence. The other thing which came out in COVID-19, the balance shifted from individual patient care to the population health. Because dealing with COVID-19, even you look at the Ethraz app and a number of other things being done over here in Qatar, it is about the population health approach. And in Scotland, which is one of the, maybe in my view, in one of the best countries in the world where the data is collected in a very comprehensive manner, like many of the Scandinavian countries. And then in Scotland, we divided the whole country into 6,976 data zones. And there are 7 domains of data collected on every person living over there. And in each zone, there are 760 people are. So we have got the data on the collective data on 760 people about their income, about their employment, education, health. And when you use the clinical data and demographic data, you are able to have applied intelligence which can make the right difference in the life of the right people. So this is another example. When we use the collective data in Scotland, we were able to see in which part of Scotland there is an excess death due to COVID. Because people could say the patient had the diabetes and patient died and there was overriding COVID. But we did a detailed analysis because we wanted to know that how much people are affected by COVID who have got the chronic diseases. And this is another example we have learned from COVID-19. I mentioned about predictive analytics. This is an example of predictive analytics that when we have got the right data, we can pull it together and we can do the prediction that which person living in Scotland is going to be admitted in hospital in the next 3 months. And it means you can take some preventive actions. And one more thing before I move on to my last 3 or 4 slides, that talking about chronic diseases, childhood obesity is a problem everywhere, including Middle East. So what we did, we identified where is the children who are obese living in Scotland and how far they are from the fast food restaurants. So you can understand, and then you can do the public health intervention. This is something which came out of COVID because we are doing the geographical mapping of COVID, and then we realized that there is obesity challenge, and we need to look at what are the factors which affect obesity and the fast food restaurants, and this is the way we did it. The other thing which came out of COVID, that although we collect a lot of data, health system collected a lot of data, but we realized that there is not enough data and digital literacy among the clinicians. It means ability to access, understand, use, and share data and digital tools to improve health outcomes. So this came out very clearly. And I think many of the medical schools and many of the postgraduate training programs, they are now mainstreaming data and digital skills in their curriculum. So this is one positive thing came out, because if you want to do telecare, telemedicine, or you want to do the modern digital tools, that your clinical workforce should be able to handle them and to use them effectively. So moving very swiftly, that health challenges and Qatar. So this is the data on Qatar, which shows that what was the state of play in 2009. If you look at the top three causes of death, it was road injuries, ischemic heart disease, and diabetes. And still, we have got the same challenges. And how best we can deal with those challenges which are happening in Qatar and in most of the Middle East by utilizing all the things we have learned from COVID-19. So this is this second last summary slide. It says, if you want to shift the balance to transform healthcare, it should be, the first is from healthcare to health. Second is from patient-based to population-based. Third is from curative to preventive services. Fourth is from hospital to primary care. And last but not least, from service quality to clinical quality. So to transform all those things, we need to be thinking how best we can learn from COVID-19. And these are the three last summary lessons I would leave you with, that this is what is my personal conclusion, and I'm sure it will be your conclusion as well, that first aim to establish a comprehensive national applied health intelligence. So we have Cerner over here, and we need to look at how best we can bring the EPR with the population health data and have the applied health intelligence. Second, we need to enhance digital and data literacy among the clinical workforce. And third, to keep the momentum going for the telehealth and telecare services. So these are the three main things we need to be considering in the coming months and coming years in order to bring the best out of the COVID-19. And on that note, I would like to say thank you, and it was a pleasure to talk to you today.
Thank you, Professor Adil, for your insights and valuable knowledge imparted to us today. Your intellect is truly valued.
Humanity, rising to the challenge of a lifetime. But we're not done yet. Better has just begun. Let's make healthcare reach everyone. Let's push this world forward. Because together, we make life better.